Now that we have our indicators, we're going to look at means of verification. What is the source of data, who's got the information, and what is the method we're going to use to show that that indicator has actually been met. And that is the third column, and we need MOV, means of verification, alongside our indicators for outputs, outcome, and impact. So what is MOV, means of verification? It's the source and the method that we use to show that the indicator has been met. So we can use various tools to get that information, and we'll have various sources, various people that we may go to get that data. And the tools that we can use are surveys, questionnaires and checklists, individual interviews with what we call key informants, key informant interviews, or interviews with the community, observation, physically inspecting and observing practices or availability, etc., etc. Document review, desk study, using documents that are produced by other organizations or by the project itself, focus group discussion and community meetings, and the case study method. Let's return again to the IDP camp. Here are our indicators. What is the source and method of getting that information? How are we going to know that we have improved access to water and sanitation? How do we know that overcrowding has been reduced? What are we going to use to verify that awareness has increased? How will we know that we have these better living conditions? And what's the source of data for a reduction in waterborne disease? Again, pause. Use your imagination if necessary, and we'll discuss shortly. So I've color-coded things a little bit here to make it a bit more obvious. Let's start again at output level 1, 2, and 3. We have two methods: distribution reports and observation. Distribution reports will tell us that these services have been provided. Observation will tell us about the functionality. Let's look at numbers 4 and 5. This is the reduced overcrowding, progress reports for the distribution of the tents, and again observation to check that the occupancy is as we expected. In 90% of the tents that we observe, it should be fewer than 10 people. And how are we going to measure awareness? We're not going to do that by observation exactly, but we can use a community meeting, a focus group discussion, to check that the message has been received and understood. Moving up to the outcome level, within 2 weeks, everybody will have access to safe water, hygienic latrines, and safe accommodation. Observation will tell us that those things exist, and a community meeting will give us the qualitative aspect about whether it's enough, whether they're considered hygienic, and whether they feel safe. And how are we going to know if the number of cases of waterborne disease are reduced by 50%? Observation won't work, focus group discussion won't work, distribution reports won't work, but we can access the camp health post reports and see there if those cases are falling. So that's our means of verification at that level.